So I'm very happy to welcome Devika Pillai to the podcast. She has done her science in nutrition, health, and dietetics. She's talking to us all the way from Vancouver. What inspired you to go into this field?
So I got to see people at different stages, and I found that there's a lot of scope for nutrition education when it comes to cardiac nutrition. And my first job out of university was also in a hospital that specialized in cardiology.
What is a heart healthy Indian plate?
You usually say like not more than 25 to 30% of your calories per day should come from fat.
What is your take on protein? Do we need more in the Indian diet? Indians really deficient in it? Or is it just
I wouldn't say we're deficient. It's just trying to so plant-based diet, you can definitely get enough protein that you need. I follow like also the Canada's food guide. So what a balanced plate looks like is a quarter of your plate is protein. Yeah, your dahi, your dal, lentils, beans, a non-veg protein as well. So eggs, fish, chicken. The remaining quarter or the other quarter of your plate is your whole grains. And then the remaining half of your plate, that's your vegetables. Just taking the protein supplement is not necessarily giving you that fiber.
Welcome to the Rita Date Show, where you find information on M&M, mind, nutrition, movement. Information all backed by science. So I'm very happy to welcome Devika Pillai to the podcast. She has done her science in nutrition, health, and dietetics from University of British Columbia in Vancouver, right? So she's talking to us all the way from Vancouver. So we're very happy to have her. She's passionate about her field, and right now she is working at an acute care hospital, working primarily with cardiac patients, both inpatient and outpatient. So welcome, Devika.
Thank you so much for having me.
So what inspired you to go into this field and specifically steered toward cardiac? So can you tell us that?
Yeah, for sure. So when I was a student, we did rotations in different parts of the hospital. So I did, geriatric medicine, internal medicine, diabetes outpatient, and things like that. But I think cardiology was really special to me. I got to see patients at different stages of the cardiac journey. So there were patients who were coming in just for prevention. I worked in critical care. So I saw people coming in right after they have had a heart attack or a cardiovascular event, and then also people in post surgery, and then also in rehab. So I got to see people at different stages, and I found that there's a lot of scope for nutrition education when it comes to cardiac nutrition. And so that was something that really caught on to me. And my first job out of university was also in a hospital that specialized in cardiology. So they had a lot of patients who had acute heart failure or had heart transplants. So I got a lot of exposure there as well.
Okay, wow. And cardiac issues are a big thing in India. I myself have had an angioplasty. So when somebody does have one of these heart attack or angioplasties, and then you go to their room and give them advice, like what's the general advice you give?
Yeah, so usually right after they've had an event or angioplasty, we're not focusing too much on nutrition. It's really making sure that just they're eating enough, because typically in that short period of time after an acute event, their appetite is low, they're not feeling well enough to even eat anything. So we're not really focusing on eat this, don't eat that. Nutrition is more like a long-term approach. So before they're discharged from the hospital, that's when we're really trying to make sure that they have the right tools on changing, making dietary changes so they can follow a more heart healthy diet in the long term. So what that looks like is focusing on what is a heart healthy diet, what does that look like. We educate them on what fats are, what are different types of fats, what is fiber, where do you get fiber from. So it's discussing a little bit of that, and also focusing on blood sugar management or hypertension, because all of these things along with cholesterol management are important for your overall cardiovascular health. So it's really taking a close look at their current diet and seeing are they missing something or is there an excess of something, and trying to pinpoint what dietary change can really make a significant impact to that specific individual.
And that must be in a, it's a very, it's a melting pot, right? Vancouver. So you have so many different types of ethnicities and it's like different diets. And so,
Yeah.
what about like the Indian diet? Let's talk about that.
Yeah.
What is a healthy Indian plate? A thali or,
Yeah, so when it comes to heart healthy meals, I like to think about, the um a few different things, but we can focus mainly on fats and fiber. So it's
okay.
really the type of fat and the amount of fat in your diet. So, you usually say like not more than 25 to 30% of your calories per day should come from fat. It also matters the quality of the fat. So really choosing more of the unsaturated fats in place of your saturated. So in the Indian diet, we use more of the ghee, butter, coconut oil, and those tend to be more saturated. So instead, switching to more of the mustard oil, olive oil, canola oil, avocado oil, that would be like a
A
good
better
switch.
thing. Hmm.
Yeah. In the Indian diet, there's also a lot of plant-based, it's relatively a plant-based diet. So, a lot of beans, lentils, pulses, legumes, which have a good amount of fiber, and fiber is protective for your heart health. So I feel like
So
that is
that's a
one
good
area
thing.
that the
Yeah.
Indian diet is a good thing, yeah. That we want to do more of that in our diet. Apart from that, I would say there is some significant amount of simple carbohydrates or refined carbohydrates. So, white rice or refined maida products, or our snacks can be a little bit more fried and fried foods. So that is just another area that we focus on trying to limit.
Hmm. Let's talk about coconut oil. Um,
Yeah.
um, I know it's a saturated fat, but
Yes.
that's what people have grown up on, especially in the South,
Yeah.
Karnataka or Kerala. So
Yeah.
how do you tell them to change it as well, or use less of it, or what do you suggest?
Yeah, we try to see what in their diet is really possibly increasing their LDL cholesterol. So we're also
Okay.
looking at the blood work and seeing, if their LDL cholesterol is elevated, and then looking at the diet, what are the sources of saturated fat? If they're also eating things like, the skin on the chicken or red
Hmm.
meat or fatty cuts of red meats, is really looking at all the sources of saturated fat and trying to limit that slowly. So if
Yeah.
you're also eating fried foods and you're using coconut oil in your cooking, I would first try to limit the fried
Reduce
foods,
the
and
snacks.
then yeah. So seeing where is that significant amount of fat coming from. But yeah, overall I will still suggest, even though it is a traditional foods, enjoying it in moderation, but just trying to limit it overall in your diet.
Okay. What is your take on protein? Everyone is talking about protein, protein, protein. We're not getting enough of it. Do we need more in the Indian diet? And will it help our lipid profile or our overall heart health?
Yeah, so protein is definitely an important macronutrient. So it's essentially we do need it in almost every meal and snack, and not just for like your functional strength and movement, but also it's like the building block of all your hormones, your enzymes, and also just for tissue repair. So I do think that is also it's like a trend at this point. Like
Yeah,
nowadays
that's
in
the,
the market,
is it a
everything has
fad? Is it a
protein in it.
trend? Yeah, I mean, or are really Indians really deficient in it? Or is it
I
just
wouldn't say we are deficient. It's just trying to, so plant-based diet, you can definitely get enough protein that you need. It's just making sure that you are doing that mindfully. So in
yeah,
the morning, if you're having a meal, it tends to be a little bit more carbohydrate heavy. It doesn't mean that we are not having the pulses and the legumes. We just don't necessarily eat it in quantities large enough to give us our protein intake or adequate protein intake for the day. So typically, your adequate protein, it depends on your body weight, your physical activity, your stress factors. If you've had surgery, that will also increase your protein needs. So usually it's a very big range. Typically, we say like zero point 0.8 grams per kilogram of your body weight. That's how much protein you should be eating in a day.
hmm.
And then that's a good baseline to start with.
Okay. So
Um,
on a thali, that's what
yeah.
I've advocated is if you have one katori of dahi, one
Yeah.
katori of legumes or pulses, and then a dal. And then, of course,
Mhm.
other things do have protein, a little bit of in your
Yes.
chapati or whatever. So is sufficient for that meal, enough protein, do you think?
Yeah. So, yeah,
I
it
mean,
definitely depends on
depends
the
on
size.
the body
Yeah.
weight, but in general, like
In
for
general,
someone who's
yeah.
like like 60 or 70 kgs, that
Yeah.
that should be good. But like you said,
Yeah.
you have to be mindful because you have to try to get this at like every meal at some time
At
at
every
some
meal.
yeah. So
Exactly. So what we typically, I follow like also the Canada's food guide. So what a balanced plate looks like is a quarter of your plate is protein.
hmm,
So if your quarter of your plate, that's yeah, your dahi, your dal, lentils, beans, nuts and seeds,
hmm,
cheese, and your a non-veg protein as well. So eggs, fish, chicken. The remaining quarter or the other quarter of your plate is your whole grains. So that's your more like millets, brown rice, whole wheat bread, chapati, and then the remaining half of your plate, that's your vegetables. So that is kind of considered a
the
balanced
smart
plate.
plate.
And
Yeah.
eating in that way helps you make sure you're getting enough protein at each meal. So it's really also, yeah, like you said, about getting enough protein at each meal. But
Yes,
I don't
yes.
really think we need protein supplements in our diet. I think if you're able to eat the protein foods, that is ideal. Because, if you're eating your beans and lentils, you're also getting fiber. And
Hmm.
that fiber is important for your heart health. Just taking the protein supplement is not necessarily giving you that fiber.
Right.
Similarly, like if you're eating your fish for protein, you're also getting omega-3s, which are good for your heart health.
Hmm.
So it has like a lot more complex benefits than just the protein or the amino acids itself. So the
Hmm.
nutrition profile of the food matters. But if you're not able to get protein from your diet, supplementing is great. It's not like supplementing is, I'm against supplementing. It's just trying to focus on food first and then powders and other things as a supplement.
Absolutely. That's a very good point because food it's very complex in the sense that so the micronutrients, how we absorb them, and their combination with other foods and the effect on the
Mm-hmm.
body is so nuanced. And
Mm-hmm.
this people don't understand that you're just taking the powder isn't going to do what the food does in the right
Yeah.
way. Yeah, so that's a very good point. I want all the listeners to listen to that. So if somebody comes to you, I think everyone is very concerned with their numbers. Like an outpatient who has high cholesterol, they come to you.
Yeah.
What numbers should they be concentrating on? Triglycerides or HDL, LDL, or
Yeah.
combination? What's more important?
Yeah, so yeah, when you look at your blood lipid report, you'll have your LDL, HDL, total cholesterol, your ratios. And so like it can be quite confusing. And most people tend to just look at next to the blood report, it says normal range, and then they just compare it. And if it's within normal range, they feel like that's good enough. It really depends on your individual risk factors. So if you've already had a cardiovascular event, obviously your targets are going to be, especially for your LDL, is going to be much lower. And if somebody is at higher risk, the doctors will want to see your numbers of LDL even lower. So I usually in the clinic that I work at, we typically look at LDL because that
Hmm.
is directly linked to showing how much plaque formation is in your coronary arteries.
Okay.
So things like total cholesterol, HDL, those are good markers as well to give us a good full picture. But LDL is typically the one that is more focused on. Sometimes the LDL, like you mentioned, triglycerides, that's a type of fat in our blood. It's not the same as cholesterol. So if your triglycerides are elevated, your LDL may be inaccurate. So in that case, there are some other blood markers we need to be looking at, like non-HDL, or there's a protein called ApoB.
Yes, I was
So
going to
there
ask you
are,
about that. Yeah.
yes, so
Yeah, go
ApoB
ahead.
is also that we look at, that looks like the number of particles in their blood. So it's slightly different, and so I find that the ApoB and LDL tend to give us a better picture of your coronary artery disease risk.
Okay, so those are yeah. And can you just go back to the triglycerides? What can you explain that a little bit?
Yes, for
Um,
sure. So
yeah.
Yeah, so triglycerides is a type of fat in our blood which can also increase the risk of heart disease. But it's impacted by a couple of different things. So your cholesterol, it's impacted by genetics and your diet and your exercise. And similarly, your triglycerides is also impacted by genetics, diet, exercise. But in terms of the diet, it's slightly different. So apart from the fats, we also look at excess carbohydrates. So sugary foods, refined carbohydrates, those tend to drive up your triglycerides. Or
Triglycerides.
eating, yes, or eating like excess calories. So if you're eating, a really heavy meal which is high in calories, that also can increase your triglycerides, as well as alcohol. Alcohol and smoking tend to
Okay.
also drive up your triglycerides. So your management is, I find a lot of overlap between your cholesterol management and triglyceride
Mhm.
management. Cholesterol is a little bit more focused on fiber and fat, and in triglycerides, there's a little bit more focus on the fat and type of carbohydrate in your meal.
This is very good explanation because people are a little bit confused. But like you said, it's all in one plate, and you have to be careful
Yeah, it's
of
hard to kind of focus on one thing at a
yeah.
time because, yeah, it inadvertently just affects, your whole body in different ways that you can't focus. Like medications are a lot more targeted approach. Like,
Hmm.
the statin is going to help with your LDL reduction. With food, it's like we're trying to limit the saturated fat and replace it with unsaturated, and that has been shown to help reduce LDL, but it is not as straightforward as um, you won't see that benefit in as a straightforward way as medications will.
Okay. Um, for triglycerides, well, I'm sorry, for LDL, if someone comes in with a high LDL and everything else is like kind of okay, so what do you just tell them to reduce the fat, basically, reduce their fat intake, see what kind of fats they're eating. Yeah.
Yeah, so when looking at it from a diet perspective, yeah, I would look at, what type of fats are they eating, how much fat are they eating. Um, I'll try to see if there's some high sources of saturated fat and try to advise them to reduce that and in place replace it with some more of the unsaturated fats, which are more heart healthy. So it's
Hmm.
not that fats in general are bad or we're trying to limit all fats in general. It's just trying to make a switch from less saturated and more unsaturated. And
Hmm.
then also focusing on fiber. Because I feel
Hmm.
like a lot of times you're only discussing fats when it comes to cholesterol or LDL cholesterol management, and we leave out the fiber. Um, Fiber we get from fruits, vegetables, whole grains. And, we do need a variety of fiber in our diet. So, like I mentioned, that balanced plate, if you're
Yes.
able to get that half a plate to be vegetables at each meal
Hmm.
and then a quarter whole grain, that's a good way of making sure you're getting adequate fiber in your diet.
Yeah. So what has happened in the in the Indian context is people are eating out. I would say at least 3 meals a week or so, whether it's at at some like a function or a friend's place, or they go out to eat. So
Yeah,
that fiber is gone. I mean, no, whatever it
exactly.
is, you're not getting the same amount of fibers that the homemade foods, that the lentils and the whatever rotis, types of rotis. So I think that has really affected our fiber intake and even
Mhm.
protein intake. I mean, we say if you're non-vegetarian, but the way non-vegetarians eat, at least in Maharashtra, they might
Mhm.
they might that's all they eat, and they might eat only
Right.
twice a week, or that's their intake. And when they eat that, they eat only that, and this is not balanced. So
Yes, exactly.
if they say they're non-vegetarians, it doesn't mean they're getting enough protein, unfortunately. So this has
Mhm.
been, as you know, happening in the country for many years because of globalization and all the junk foods and outside foods that have come in. So do you find that your cardiac patients are getting younger and younger?
Well, I haven't worked for long enough to see a shift in the demographic of the patients, but I will say that, genetically, cholesterol that is impacted by genetics. We see patients very young as 8 or 10 years old.
Oh,
Um, but in general, people coming into the hospital after a heart attack, they're also coming in quite like in their 30s and 40s. And I've definitely seen those patients. So it is kind of scary, but it's also a lot more discussions happen around, identifying your individual risk. So seeing if you have a family history of heart disease, and then making sure you're getting, discussing that with your doctor. So you're getting your blood work done on time, and then you're doing any diagnostic testing that needs to be done, well in advance so that you can be
hmm.
prepared for your future.
Yeah, people are getting tested more and taking steps. So
Exactly.
two questions from what you said. Um, why would you see someone so young? Is it because they have a heart condition, or are people just checking, or someone like 8 years old,
Typically,
you said?
yeah, they usually come in because their parents have had high
Oh,
cholesterol from a young age as well. So yeah, familial hypercholesterolemia. It is more of like a genetic condition that gets passed down. So, even if the child is extremely active, there is no obesity, no excess body weight. They're eating a heart healthy diet because their parents are very mindful and controlling their diet. They will still have high cholesterol levels.
oh, okay,
So yeah,
okay.
it's more of like a genetic driven condition. So we do see them because it's more of the education on what they can add. So with kids, we're not telling them to limit too much in their diet. They also need
That's very
to
hard.
enjoy
Yeah.
food. And yeah, so just about what more they can add into their diet to make it more heart healthy, or just teaching them or giving them some nutrition education at a young age so that when they're older and making their own choices, that they're, better equipped.
Yeah. Sometimes, I find that you tell them all this. They don't listen and they don't really follow it for a while, but it does click later on. Like I think,
Exactly.
yeah, it clicks later on, maybe in a couple of years or when they're maturing or something. All
Yeah.
that education really, really does help. So
Yeah.
the other question was, so the people that who are on statins, do they
Mhm.
just forget they're on statins and eat whatever? Do you find that? Is it hard to educate them?
Yes.
Yeah.
It is. It definitely is because a lot of people are coming in. They're like, well, now that I'm on a statin, does it mean I can eat whatever I want? Or they feel like, they can relax a little bit on their diet and lifestyle factors because that they have the medication that's helping them control their cholesterol. And we still focus and try to, give them a whole rundown on why nutrition is still beneficial. Even if your
Mm.
LDL are now under control with your statins, like I mentioned, the food is going to bring like a completely different, it's not just helping you reduce your cholesterol, it's also helping you manage your blood pressure. It's also helping you with your blood sugar management. So overall, it's going to help you reduce your cardiovascular disease risk in multiple different ways.
Yeah.
And so that's, and even with your digestion, and so that, and making sure that you have enough muscle mass and you can continue to be physically active. It's a little bit of a harder approach because people tend to only want to change their diet once something has happened and they feel like they are a little bit more desperate, they're more motivated to make diet changes. But diet and lifestyle changes are the hardest to kind of sustain.
Yes,
um,
it's quite simple, but very difficult to follow. It's
yeah.
like simple things, but it's difficult to do on a regular basis.
Yeah.
So yes, I absolutely agree. What about our blood glucose levels? How directly is that related to heart conditions? And the big thing now is having those blood glucose monitors. Is that
Yeah.
a good thing for cardiac patients to try out?
Yeah, I would say, with blood glucose, if you're poor blood glucose control, that can impact your coronary arteries as well, and then that will also increase your heart disease risk, having poor
Mm.
glycemic control. So it is important to make sure that that is well controlled. If somebody has diabetes, then I would say, or maybe pre-diabetes, then I would say a continuous glucose monitor can be very helpful in
Mm.
helping them understand, what type of foods are increasing their blood sugar levels, how is exercise or stress affecting their blood sugar levels so that they can make modifications according to that. If somebody is taking insulin, it's definitely important to be monitoring your blood glucose. But I think if you don't have blood sugar, right now your A1C is within range, and overall you don't have massive spikes in your blood sugar, you don't necessarily need to be on a continuous glucose monitor. It needs to be assessed on an individual basis. It's not necessary
Yeah,
or
yeah.
appropriate for everybody. It can be a little bit of an overkill at times.
Hmm.
Um, I think for a short period of time, if somebody has prediabetes, you can try it on for 2 weeks, see, oh, I see my white rice is impacting my blood sugar more than the chapati is. Or like if I go
Okay.
for a 10-minute walk after my meals, I notice my blood sugar is coming back down. So it helps them kind of, really set those
The
habits. And
habits in
yeah,
line. Yeah.
yeah,
Because it's
yeah.
a kind
So
of a, I wouldn't say a trend, but many people are just getting it. They think it's helping for weight loss or a thing, but it's should be just targeted for that, for monitoring the blood glucose levels if you need it, if you need to
yeah,
monitor it, right?
if you need to monitor it, it's also quite costly. So like it is not, advisable for it's not achievable for everybody.
Yeah.
Even the blood glucose monitoring is accurate, and doing that a couple of times a day or taking an average of your readings is enough. Like your A1C is your 3-month average, and that's the gold standard indicator of your blood glucose levels. So if you wake up one day because of what you ate the night before, or so many things can impact what your blood sugar level is like at a period of time. So I
Mhm.
find that it's just easier and more beneficial to look at the average. And for some people, it's definitely helpful to look at their continuous blood glucose reading throughout the day.
Okay. I remember once we had a conversation and you said that your patients come with lots of research. They might have a stack of research or on their phone or whatever. And there's lots of information out there. I mean, health is a big thing and, supplements and testing and food, exercise. It's just so much information out there. So when they do come with all this information, what do you say to them? Because I'm sure a lot of our audience does that. So, or
Yeah.
just some simple advice.
Yeah. And I used to be somebody who also did that. I think I used to go to
I know.
a doctor with a
Yeah,
list of
we
questions
need to
prepared.
we might like to know what's out there, and it's interesting. And yeah, go ahead.
Yeah. So I think it's, important to do your own research. I don't want to discourage people from doing that. I don't want to say don't look into Google, just listen to me. That's not the right approach. I think people need to have some health literacy and health education, and most of that comes from the internet. But it's also understanding the limitations of, firstly, there's a lot of misinformation on the internet. There's always going to be two sides to every answer. If you Google, is coffee bad for you? It will say yes. If you say, is coffee good for you? It will say yes. So it's able to understand and do have some kind of critical thinking and judgment to really interpret what you're reading, and also the credibility of what you're reading. Like research papers, even reading a research paper can be quite, intensive, and you're looking also at the patient population, the statistics, and then, looking at multiple papers and then coming to a conclusion. So
Hmm.
it can be quite challenging and overwhelming for people. So I think doing your own research and then coming up with a question and having a discussion with your doctor is important. And getting, multiple different, having discussions with a couple of different healthcare professionals will also help you get a holistic point of view. So it's just understanding your limitations. For example, when we were discussing LDL, if you look at the blood report and you're like, yes, my LDL is low, I'm
Hmm.
okay. The internet says it's okay. But you may not know that if your triglycerides are elevated, your LDL
Hmm.
reading is inaccurate. So it's
Hmm.
just always keeping in the back of your mind that, you may not know everything, and what you're reading may not apply to you.
Right.
So just being curious about that and having an open mind when you're discussing it with doctors.
Yeah. Okay. That's a good point. Good answer. I mean, do the research,
Yeah.
but do it mindfully and yeah, take it from there.
Yeah.
So, what about Indian snacks? Snacks are a big thing. What do you suggest? Any healthy snacks that, besides, I mean, of course, fruit, nuts, Those are there. Firstly, dry fruits are a big thing, and I think people are overdoing it with the dry fruits because it does.
Yeah.
It's a calorific, right? It is a lot of calories, which can make you put on weight. But any other
Yeah.
like lower fat snacks could you suggest?
Yeah, so a heart healthy snack would be
Yes.
something that is, um, in the right type of fat and a good amount of fiber. So, for example, like you mentioned, nuts. Mixed nuts are great. We do actually recommend eating mixed nuts every day, but the quantity matters. So,
Hmm.
not more than a third of a cup per day. And
Okay.
those are simple snacks. So, if somebody's in a hurry, something you don't need to prepare. So, fruits, nuts, whole foods, even low
Hmm.
fat Greek yogurt, those are great. If you do have some time to prepare some food, then like a chia seed pudding. So chia seeds are, when they do, so anything that swells up in water, when you add it to water, it absorbs water. It's got something called soluble fiber. And
Hmm.
that's also been shown to help with cholesterol management. So that's specifically why we speak about chia seed pudding. And then also your roasted chanas, so your
Hmm.
beans, lentils, pulses, or your moong dal chaat or chana chaat with vegetables, that's great source of fiber and protein right there. So as long as it is more whole food based, it's always going to be better than like a processed
Yes.
nutrition or protein bar that you find in the grocery store.
So this
So
wasn't
yeah,
an issue before, but in India as much, but now if you go into a grocery store, everything is filled with all these processed foods, quick like a lot of bars you see, especially when
yeah,
you're checking out, that
yeah.
is filled with all these things that they look healthy, and people are not educated or don't know enough that it's not really not. It's a healthy
Yeah,
bar, but it's
yeah. So
full
I
of
find
other
that
stuff. Yeah.
Yeah, so I find that it's the ultra processed foods that we want to be a little bit wary of. But all foods are processed to some extent. So I do think there
Yeah.
are some like protein bars and nutrition bars that are great. It's convenient. They will be lower in sugar. It might have a decent amount of fiber. But like you said, it's not having the education or knowing how to read the nutrition label. So really reading the ingredient list and seeing, looking at the table and seeing firstly, what am I even supposed to be looking at, and what is considered high and what is considered low. So I think if people can do that, at least when they are at that section, they can make a more informed choice.
So
So I think
what's
there
the
is,
difference between an ultra processed food and a regular processed food? I mean, I
so like,
know everything
yeah,
is processed, even like the wheat we buy is processed, but
yeah,
yeah, so but a little bit more processed, the difference between
yeah.
ultra processed and yeah.
Yeah, so like with the processed food, you can still. I like to think about it like you can really still see the whole food in it,
Uh-huh.
sorry, the minimally processed food. So
Okay.
even if it's your canned food, your canned chickpeas or things like that, it's still processed, it's preserved, but you can still see the
The
chana
whole,
and
yeah.
you can recognize it. So it's a little bit, that's just an easy way of thinking about it. But really, foods that you're not able to even, when you look at it, you don't know where it even came from or what the composition of the food is.
Okay.
That's the ultra processed food.
Hmm.
It typically has no nutritive value
Hmm.
and, empty calories, we call it. So it's higher in sugar, higher in fat, and then very low amounts of protein or fiber, vitamins, and minerals. So that's your ultra processed. So, sweetened beverages, diet like your soda, pop, things like that, or chips and cookies. Those tend to be more ultra processed. And with the ultra processed foods, we want to look for something called trans fats. So that's
Yes.
also something we discuss with our patients who have high cholesterol. Yeah, trans fats is the worst type of fat. It can
Hmm.
increase your LDL, which is your bad cholesterol, and reduce your HDL.
Hmm.
And that is really used. So usually you take plant oils, which is liquid, and you hydrogenate it to make it solid.
Hmm.
So you make it solid to make food more shelf stable. So
Hmm.
anything like vegetable shortening that is added in biscuits which have cream in it,
Or dalda.
pastry.
It's known as dalda here.
Yeah, yeah.
Yeah, that's the
I
culprit.
think Vanaspat, yeah, yeah.
Vanaspati oil.
It's
It's yeah, it's the same thing. Yeah, yeah.
Yeah.
So
So
yeah.
the hydrogenated margarine that keeps food fresh for a really long time. So if you see any wafers and cookies and muffins that really stay good on the shelf for a long time, that's probably because it has trans fat in it.
Hmm.
And the industrially produced trans fat is what is absolutely the worst for your cholesterol management. So that's typically the one thing that I'm like limit at all cost.
Okay. Yes.
Worse than the saturated fat in our diet as well.
Okay.
So
There's a
yeah,
big,
treating that. So in the
yeah, no, go ahead.
Sorry, I was just like, when you're looking at the nutrition, like a food product, an ultra processed food, some words that might indicate there's a trans fat in it would be like hydrogenated vegetable fat or vegetable oil, or like modified or hydrogenated, yeah, just partially hydrogenated fat
Partially
or
hydrogenated.
vegetable
Yeah.
softening.
How's palm oil? Palm
Palm
oil,
oil, it is also higher in the saturated fat, similar to the coconut oil.
but it's not is it a trans fat or not?
I would have to check to
Yeah, I
see
think I
trans
think it's not a very good fat in the sense it's very
Yeah.
processed, I think. So,
hmm
yeah. So
Another way
Devika,
that
what is your diet like? What do you eat in a day?
I
Not when you're home
think
with,
I
with your mom's place in India, but like let's talk about Vancouver. Like, how do you
yeah.
manage cooking and working and all that?
Yeah, I feel like it's completely different from when I'm in India. When I'm in Vancouver, it's really about efficiency and what I can make quickly. It's a lot of meal prepping, so I don't need to be in the kitchen for long periods of time. But I feel like when I'm talking to my patients every day about food, I automatically start to follow some things. Like if I tell people eat fish 3 times a week, at the end of the week, I'm always trying to make sure I'm eating fish 3 times a week. So I do try to have a balanced diet. I do eat out, pretty often because I live alone, have to cook for myself, and it gets tough. But when I do eat out, I'm just trying to make sure that I'm not going for the deep fried options, and
Hmm.
I'm always trying to make sure there's enough like fruits and vegetables in my diet. And if I'm buying something that doesn't have the fiber, I have like frozen vegetables in my freezer,
Yeah.
and I'll just heat that up. So it's kind of like mixing and matching and putting together different foods to make it as balanced or heart healthy as possible. It's definitely like a mix. I feel so. I work in an office with a lot of dietitians, and it's just so great to see everybody just having a variety of
Well, that
different
must be
foods in their
fun. Yeah, of
diet.
all these good foods. Yeah.
And
So,
nobody really has that good food or bad food idea.
yeah.
So that everybody's just eating everything, but in moderation. So that helps as well.
Yeah, because you're like regular people as well. You're not just dietitians. And
Exactly. Yeah.
so, Devika, this has been a fantastic conversation, and I want to. Can you give one takeaway that you would like to tell the audience about heart healthy food?
Yeah. So, at any stage of prevention, whether it's primary or secondary prevention, the bottom line is eat more whole foods and limit your ultra processed foods. Feel like you might have heard that again and again because that's the bottom line of most nutrition recommendations. And I think focusing on like the fiber, making sure you have enough fiber, and understanding where the fat in your diet is coming from. Those two
Okay.
things, so whole foods and just thinking about and learning about fat and fiber is helpful. um yeah, I think those are my main points to for everybody, whether you have, you know if you want to eat a heart healthy diet or just a balanced diet, that itself can be helpful.
Okay. And lastly, I know you're in Vancouver, but if someone does want to reach out to you, how do they do that, or where can they find you online?
I believe you can connect with me on LinkedIn. I think that would be the easiest.
Okay,
Yeah, I
I'll
can
put
send
that in the
you.
show notes. Yeah, but your
Yeah,
LinkedIn profile. But I want
yeah,
to
I
thank you
can
for
send you.
taking the time out of your busy schedule and talking to us today. It's nice to have this perspective and from a diet, especially your specialty, which is very interesting. And thank you. Thanks so much for joining us.
Thank you so much for your time. It's been really lovely talking to you.